Hi there. I just want to explain a little bit about craniosacral therapy and this wonderful therapy and what it does for adults this time. And for adults, craniosacral therapy is an amazing tool to actually improve their life and mentally, emotional, spiritually, also with the soul, if that's the person is inclined in that. The good things about craniosacral therapy is that it doesn't it's your system, your body, your higher self in some way that does allow things to come out, whatever they need to come out. That where it can is very good with past trauma, physically or emotionally. Um, any possible blockage that is in the body, that it doesn't flow well. The fascial unwinding, also the actual craniosacral therapy reduces the or balances the autonomic nervous system by and reducing the stress. So there is a better sleep, especially if the person is a high stress person or worry or anything like that. And and obviously, by reducing that constant stress mode and balancing the autonomic nervous system, there is a better digestion, there is a better sleeping pattern, and there is a better heart rate and breathing. So that is all connected to the autonomic nervous system being too much into the stress mode, or or too much even in the parasympathetic, if the person is too tired and it can't quite move as much. So it's an amazing therapy. Usually it's fully dressed. You can actually it is usually fully dressed. Usually use it in combination also with NLP, mindfulness, and heart math meditation and suggestion. And I'm a nutritional therapist. I have a degree in that, but usually that one I use it for allergies or overreaction to food. And it's amazing how many times just reducing the stress and resettling the body, the person actually has less overreaction to food. So it's your system. You are, or your system, your higher self is what kind of leads the therapy. So it's allowing the space, is allowing the timing, and obviously there is a certain kind of trust between me and the therapy, but also the person, and therefore the trust that anything can come up, and the person is supported in some way or another. I usually teach also some tools to take with them if I feel that they need it, so that they can carry on also at home when nobody else is available for their support. And the again, whatever comes up or from the session, it's up to the person. So quite often they say, "What do I expect?" And that is to happen in the next 5 days or week, as craniosacral therapy doesn't finish in the session; it carries on. And I usually say, well, my advice is see what happens. Each person is different, and each person will have different outcome from the session. So depending what they need to work on, what they need to release, what they need to let go, or so this is great also for children anxiety. Obviously, I work with babies and babies trauma, but it's mainly to allow the space to finally let go. It can be an old grieving, quite, or a loss of somebody, or of a loved one that the people sometimes don't have the time to let go. So if you want more information about it and how I work, just look at my website, and we can go from there. I work in London, North London, and N15, N16, and Crouch End area.